Good afternoon, I'm Jason Lusty from CFH DocMail. Thank you very much for joining us this afternoon. I'm going to provide an intro into DocMail and the services that we've adapted during the COVID period for our clients. I'm sure over the past week and a half, you've all seen some extremely impressive digital delivery to patient services and solutions. And they certainly are processes that we have and solutions that we have in place with our DocMail Hybrid Mail and DocPost solutions. However, we do believe that the letter is still extremely powerful when connecting with the most vulnerable patients in our society. And we would like to show you today what we've developed in line with our medical research and CCGs during the COVID period to manage and collaborate communications over large areas, and to give you a sense of the power of mail as well, and how important it is as we move forward, especially when talking to those more vulnerable members of the community. So to give you some idea of the power of mail, we have figures from the independent JICMail service that tells us how mail is interacted with in households. So if you imagine, their service works very similar to TV ratings. They know through software and interaction with households how mail is interacted with in a home. And for health, especially, we think this is extremely important, especially with those vulnerable patients. So to give you an example, every single health mailing that goes out that they monitor is interacted with by 1.2 people. It is read on average 4.8 times, and it stays in a household for 9 days. So every 1,000 letters you send out, 1,200 people read it 5,500 times, and they have it for 10 days. Now, we don't know yet the base figures for COVID and shielding mailings, but we are expecting that to be closer to 2.5 people. We're expecting those mailings to be read 8 to 10 times, and we're expecting those mailings to stay in a household for more than 10 days. That becomes really important when you think about the size of the flu vaccination campaign we're going to have, the continual shielding mailings that are going to be going out across CCGs and GPs over this winter. So mail is still extremely powerful. And although ourselves, we integrate digitally with delivery to app on mobile phone, and we actually integrate with a number of EMIS partners for delivery of our services, it still has an important place in the way in which we communicate. So to give you an overview of CFH and where we fit, we currently have 30,000 hybrid mail users in the UK, sending 10 million medical letters per year. 4 million medical research letters sent in collaboration with the NIHR, GP surgeries, and research teams across nearly 40 universities. 3 million flu letters each year between September and November, and 30 ongoing CCG projects that have multi-channel messaging. So though we're very much, as the slide says, we print and mail patient letters for the NHS, we still have those projects where SMS, security delivery, and letter mixed together to create the best outcome, to allow the patient that wants to put a business reply envelope with a consent document back in the post, and also for the patient that wants to send an SMS back or log into a portal and confirm their acceptance. We also work across NHS trusts, screening programs, delivering outpatient letters and results letters as well. And as I've said, we integrate with a number of EMIS partners, and outside of EMIS in NHS Trust, we integrate with a number of other softwares there as well. And in those integrations, we are working alongside electronic delivery, we are delivering electronically ourselves, we're working with SMS, and we're providing a combination of messaging to ensure that the patient that we're talking to is being spoken to in the way that they want to be spoken to and that they are most likely to respond to as well. So I'm going to take you through some of those changes we made during the COVID period, and then just talk to you more about the base product that is the CFH DocMail print driver. So during the COVID period, we certainly saw some extremely urgent mailings needing to go out. And to do that, you needed access to data and you needed the ability to send out those mailings as soon as possible. What we found was there were very much differences in the way people approached things, and access to data was a big challenge. So, for example, we had CCGs and GP groups that wished to send a shielding mailing, but were struggling to access data across the wider group. So each group would have to download their data, they were sending it in centrally, or you had a third party accessing data and then sharing again for the actual print of those documents going out. That was quite challenging. It caused delays. Data sharing agreements had to be put in place between all parties, and what actually seemed like a relatively straightforward process of, we just want you to give us the cohort that you want to mail, and then you want you to send it to us for us to send to somebody to mail for on our behalf. That actually strung out into quite a few days. So what we developed with a number of our clients, and what is actually available to all of you today, is the ability to host content in a single DocMail account, and for every GP within your group, within your CG, to have access to that content. So to give you an idea of best practice, and what one of our leading CCGs achieved, was 40 GP surgeries all required to send out the same shielding document to all of their relevant patients at the same time. The content was hosted within the DocMail account. Each GP surgery logged in between 8 AM and 4 PM on one day, uploaded their data, added it to the content. The content was distributed with their letterhead from their GP surgery to their patient base. Everybody's mail went through the process in the same day. Everything was produced overnight. Everything went out the following day. Everything landed at the same time. So within the geography, the CCG had delivered a consistent message from every GP surgery at the same time, without the GP surgeries having to send data anywhere other than to CFH DocMail. There was no movement of data around the CCG. It was a straight interaction, as it is on a daily basis between us and our GP clients, between us and the GPs, in a singular account where the CCG remained in full control of the spend. They could see what everybody had sent, how much they'd sent, on what day, at what time. So it gave everybody control over content and cost, but it actually meant the data was in a one-to-one relationship just with us and not being moved around or being manipulated in any way. That meant everything went out very efficiently and landed at exactly the same time. And I think certainly when you're working within a geographical area, it's important that those people receive their messages, receive their communications consistently. Once it becomes inconsistent, once one person within an area but their neighbour or friend a mile or two away hasn't received anything and expected to see anything, that starts to cause confusion, it starts to cause concern, and what that inevitably ends up with is someone unnecessarily calling a surgery to say, my friend, my relative has had their letter, they've had their document, but I haven't had mine yet. And that reduces that inbound amount of calls, and it reduces that inbound concern. That process and that technology and the way of managing that we've had in place now since 2010, but it's not been widely accessed or required at the CCG Federation group level. It's used on a weekly basis for medical research by GP customers involved with medical research, and obviously by the CRNs that are delivering that research as well. So it's well tested and it's available to you, and we'd be more than happy to talk about that, especially as you move into what is going to be an extremely busy flu vaccination period, and you know, not knowing what those communications are going to look like over September and into the winter. It's something that we certainly can help with. For our GP surgeries, you have access to the DocMail print driver, you have access to the DocMail website. It doesn't have to just be used in surgery, it can be used wherever you have a web connection. So we now have many surgeries accessing us and working from home. We have different teams within CCGs that are doing medicines management that are accessing DocMail now because they can't go into the surgeries. They're working from home, providing those letters, providing that documentation out to patients from their home offices. It's a virtual print driver. It's free to use. But DocMail and DocPost, our e-delivery service, there are no software licenses for any of this. You install, you only pay for what you actually put in the post. And that's really important. It saves you a huge amount of time and it saves you a huge amount of effort. You are no longer spending money on equipment, stamps, franking machines, or visits to the post office. And certainly with home working across the country, whereas people have gone home, they still need to stay in contact with their patients, with their customers, and they can print direct from home straight to us, and we will put it in the post for you. And one of the main things, even moving forward, when you go back into practices or larger offices, there's a no-touch approach with DocMail. You are only operating this from your PC. There is no requirement for you to go to a print device where many people gather. You can just press print and send straight from your PC straight to CFH. So I'm going to give you a quick overview and a quick introduction to some of the functionality in the print driver. And it is some of the functionality that I would say a lot of people aren't taking advantage of, that they aren't using. And this is all about making this process as quick and as simple as possible. So what you'll be able to see on the screen is we have a small mail merge of 4 letters for a medical practice. And we can press file, we can press print, and we can choose DocMail as our print device from all of the print devices that are available to us within our organisation. So as I press print, there is a small username password exchange between the virtual print driver and CFH. It pops open the print driver, and all of this activity is recorded within an online web account. So you can see what any user within your organisation has done. You can see if you were a wider group and if you were a CCG with many GP surgeries using this, you can see what any individual GP surgery is sending, not sending, but spending. So you can see that they've sent mailings, you can see that they spent money, but you can't actually see the data associated with it. So to keep it really simple, we have profiles. You choose a profile, it applies all of the rules associated with that document. It tells us which envelope to use, whether it needs to go first class, second class, whether it needs to be coloured, whether it needs to be black and white. So you choose profile, you press proof, and that document goes to CFH. And it creates a live proof for you. So it sends those documents, it analyses them, it sends them back. It sends a copy back to you. It doesn't send the entire file back to you. It wouldn't matter whether this was 100 letters or whether it was 1 letter. It sends the file back to you and says, this is what we're going to print. This is what it's going to look like when it goes out. Are you happy with it? We do not send anything without you approving that proof. So if I open the proof, I get the first record in the file, middle record from the file, last record from the file. So I open this proof and I've chosen a closed-faced envelope, which allows me to personalize the outer with my own strap lines if I like. So we place the name and address on the front of the envelope, and we put private and confidential important information enclosed. You can put actually whatever wording you like. Now this goes back to the point I made earlier regarding JICMail and the importance of post. And this is all about open rates. What we want to do is we want somebody to receive something and we want them to open it and we want them to take action. That's really important. And this as an actual function can be very powerful at making a piece of mail stand out when it lands on the doormat. This isn't about direct mail. This is about ensuring that the person who's receiving it recognizes what it is, recognizes it has a level of importance and opens it and takes action. So that's one piece of functionality that is available to everybody and is in place, and we can show you how to use it. If I click next, I can actually see the letter. It has a unique 2D barcode. Every single document that we send out has a unique number associated with it. This allows us to track these documents all the way through our manufacturing processes, all the way to final delivery with the Royal Mail. And then once we've handed it over to the Royal Mail, it's obviously within their power to send it, but you will always have that traceability and can have that traceability from CFH to know that we have actually sent something for you. We click OK and we hit approve and submit. Now, if I take that same document and use a different profile with a different envelope selection, you'll see what I mean with that ability to change messages within the envelope as well. So we can choose the COVID envelope and we can go straight to view proof. If we have additional documents that we wanted to add in at this point, we can choose the profile, but we can also add documents in. So if you wanted to add in inserts, whether that was some additional instruction, a health check leaflet, something specific for either the patient or the group of patients you're mailing, you can do that as well. We'll jump straight to view proof. And I'll open this proof. And what you see is we've changed the strap line. And again, we've used this with some of our mailings. It actually wasn't our wording. It was wording used by one of our GP groups, because again, there's no sense of you're breaching anything by putting this on the outside of an envelope. But what you're saying when that lands on the doorstep is, this is important, you need to open it. And that is what we are looking to achieve. And again, I actually use the same document for this. You've got the same letter, the same 2D barcode as well. So if we just jump back to the presentation. So the benefits for you as a practice, there are no license fees, there are no charges for any of this software. There's no charge for, you don't have to send any amount of volume. You do not have to commit to use this for a period of time. You have an account, you send the mail through that account, you pay for what you actually put in the post. Because this acts like a print device, because its initial relationship is a virtual print driver, there's no requirement for us to actually integrate fully with EMIS, because the print driver spools a record or set of letters exactly as it would if you were working within the practice. So all those letters that you've generated are already back against the patient record, and they're just being printed. They're not being printed locally. It's obviously ideal for home working, which we are seeing a growth in. We have an extensive amount of accreditations, which from a due diligence point of view, we'll be more than happy to share with anybody that's got any questions. But those core accreditations, ISO 27001, Cyber Essentials Plus, an HSCN connection. We're the only hybrid mail company with a consistent rating on what was the IG toolkit. But importantly, we're also the only hybrid mail company with a version within the HSCN as well, if you want to have access to that. We have an integration with our own DocPost product, which securely delivers documents to a mobile app. So if a patient does opt in, they can receive those documents electronically. And there's an extensive amount of MI reporting within the system as well. So if you want to view documents at a user level, if you want to know what people have done, what they've sent and how much that has cost, then all of that information is available for you within DocMail. And we can personalize those envelope hours as well as adding inserts where you need to add inserts. But the personalization of the envelope is quite powerful and quite important when you're looking at mailing people. We also didn't get the opportunity this year to actually host our own event in Manchester, as it got cancelled, but part of our event in Manchester was to look at best practice. and we had a number of speakers coming in to share what they have done in the communication with patients, and share those best practices and share those case studies. They've obviously still got a lot of that information. We're still gathering it together. And we're happy to share that with you as well. So from a next step point of view, myself and my colleague Shelley, who's on the Q&A right now, we provide free demos, we provide free training. There's no commitment. So if you want to have a look at this, you want to discuss this more, whether it's as an individual GP surgery who wants to use .mel moving forward, and certainly for those flu campaigns, whether you are a pharmacy who suddenly has a requirement to mail businesses regarding mass flu vaccinations for employees, and whether you are a CCG, Fed, GP group that wants to look at those wider communications across your geographical area and how we manage those and how we put all of that in place, please contact either of us. We'd be more than happy to help. We will be on our Facebook page this afternoon, and we will also be on our Twitter this afternoon if anybody has got any questions. Thank you very much for taking time to listen to me this afternoon.